Hello and welcome to Newsmax Health on Newsmax TV. I'm John Bachman and we're here in Boca Raton in the office of Dr. Melanie Rosenblatt. She's a nationally known pain management specialist. Thanks for being with us here at Newsmax Health.
Thanks for having me.
It's our pleasure. I want to talk about something that I'm sure you've seen way too often. That's when a patient comes in, if they have chronic pain and they get prescribed, or maybe even after surgery, they get prescribed an opiate pain medication and then they begin this cycle of addiction. You're also featured in a new Discovery Channel documentary called Pain Matters. Now, this documentary features 6 people who fall into that category I just mentioned, an Iraq War veteran, an ex-pro hockey player who all deal with pain on a daily basis. Why did you do the film, and what are these stories about people in this documentary tell us about pain management today?
So I did the film to help look at this problem of chronic pain and how it affects people. The film was really designed to show how patients suffer in chronic pain, how debilitating it can be, how it can cause depression, isolation, loss of job, loss of income, and feelings of worthlessness and helplessness, and how it can affect relationships. The film also focused a lot on the caregiver and how they have unique issues as well as trying to take care of their relationship and their loved ones and watching their loved ones suffer in pain and their own issues with how it's frustrating to deal with that and it's unhappy. So I think the film did a really good job of showing through the lives of the patients and their caregivers what it's like to live with chronic pain.
And what is it like for someone when chronic pain becomes a part of their daily life, their interaction with their family, their friends, their coworkers? What is the most obvious thing that's affected when people deal with this?
In a word, everything. I mean, it colors everything from you can't sleep to you have trouble getting out of bed to the pain because of the pain to you can't walk your dog or get your mail and you can't do simple basic tasks for yourself and your entire world becomes consumed with pain. And until you've experienced unrelenting chronic pain, I think you can't really appreciate how all-encompassing that is.
It's particularly addiction to OxyContin and other opiate drugs has become such a huge problem, not just in this country, but also specifically here in South Florida where you practice. Have you seen people who come to you for help, and how do you get them past this dependency issue?
That is such a complicated world, and it's what I deal with day in and day out, both in the hospital setting and the acute care trauma center that I work in, and in my offices. So like the patients in the film that often start with an annoying pain or something happens early on, the film didn't really talk about what happens with addiction and with the medications that you mentioned, but what I see happen a lot, and particularly down here in South Florida, is patients are prescribed a strong opiate to control acute pain, which is appropriate. I mean, acute pain serves a very useful purpose and it's self-limited. So in theory, once that painful problem, whatever it is, the disease, the broken bone, whatever it is, once it gets repaired or heals with time, the need for opiate pain medicine should really go away. But often what we see is the opiate pain medicine itself has its own effect, and it makes people feel not only less pain, but feel sometimes something else that people have described to me as an energy or a generalized sense of well-being where they just feel better. And perhaps they even start timing that medicine, so they'll take it before they go to bed at night because they'll sleep better, or they'll take it before they go to dinner at night because they're more relaxed, or they start taking it for more what we call non-medical purposes.
Recreational use.
Well, we like to say non-medical, but it's very hard to separate out because when you talk to these patients, they'll say, well, no, I take it because it makes me feel better. And feeling better is different than pain going away, although certainly part of pain going away is feeling better. But some medicines are more euphorogenic is the term that we use, makes you feel good. Some medications are more prone to that euphorogenic response than others. So taking a pill to feel better is different than taking a pill to take the pain away.
Certainly, and I think that makes sense, but obviously it's different for these folks who are in this cycle. But you do say there are alternatives to these very addictive pain medications for chronic pain, common types of chronic pain like back pain, arthritis, and surgical pain. Can you briefly talk to us a little bit about these alternatives to these drugs?
Absolutely. First, I think it's very important to separate the addiction issue from the pain issue. So we'll talk about the addiction issue in a little while. So the pain issue itself, there are many non-opiate alternatives to treating chronic pain. To use your example, chronic back pain. Chronic back pain may get better with massage, heat, yoga, physical therapy, other non-opiate medications, other non-steroidal medications, muscle relaxants, other classes of medications. Some of the anticonvulsants help for chronic pain. And then a big part of what we do in interventional pain management is just that, interventions, nerve blocks, injections, epidurals, different kinds of injections and implantable techniques that can help actually address the pain itself.
And so we're not just talking about, some of the things you did mention, like yoga and stretching, where people might not really want to do that stuff, but there are other alternatives as well, different medical alternatives, different pharmaceutical alternatives.
Yes, there are pharmaceutical alternatives and there are non-pharmaceutical alternatives as well.
Well, pain is something we're all going to encounter at some point in our lives, an enlightening conversation. Dr. Rosenblatt, thanks for being with us.
It's my pleasure.
And thank you for watching Newsmax Health on Newsmax TV.